Next, let's talk about the different types of pigmentation, which I usually divide into 3 categories. The first category is superficial pigmentation, which includes sunspots, freckles, and age spots. These can be treated through epidermal scabbing or minimally invasive methods to help them peel off naturally. Usually, a spot size of 3 and energy around 0.4 are used for the treatment. The surface pigment blisters and bursts, then forms a scab which will fall off as it metabolizes naturally. If you prefer a non-invasive method such as light or heavy sanding, that's also possible. But the cycle is longer and metabolism slower. This is because less melanin is broken each time, so more sessions are required for full metabolism. The second category is deep dermal pigmentation. This includes café au lait spots, odas nevus, and itos nevus. Odas and itos nevi are congenital and usually appear during childhood. Deep pigmentation requires using a heavier or slightly lighter sanding mode for treatment. Because the pigment lies deeper, it needs to be effectively shattered at the deeper layers. Once the melanin is broken down, it can be metabolized through scabbing or by macrophages within the body. During treatment, due to higher energy and smaller spot density, the epidermis may experience some injury. Deeper pigment particles can be shattered, but the deeper they are, the fewer are broken. The smaller the pigment particles, the easier they are to metabolize. If the treatment is too strong and causes epidermal blistering or deep penetration, repair products must be used for recovery. When the operator's technique is insufficient, or the client's recovery is poor, skincare products become essential to support metabolism and healing. The third category is mainly melasma, such as liver spots, pregnancy spots, and butterfly-shaped pigmentation. Both the epidermal and dermal pigments are active, so the skin must not be overstimulated. After treatment, there should be almost no visible reaction. Use brightening products to help the skin regulate pigment metabolism naturally. When treating melasma with a device, use a large spot size and low energy. The epidermis should only feel slight tingling or no reaction at all. The deep pigment will be shattered, but with mild strength. You need to rely on skincare products to suppress unformed melanin and help metabolize the shattered pigment, accelerating the process. Never use strong energy when treating melasma. Excessive treatment can cause hyperpigmentation. This is the skin's protective mechanism after injury. Don't chase instant results while ignoring delayed reactions. These are the 3 types of pigmentation, along with their treatment methods and key precautions.